To Sarah Hewson. Hi, Sarah. And down the line is GP Dr. Philippa Kaye. Thank you both for joining me. Let's start with Sarah Hewson on this one. I mean, it seems as if the stories about and around Kate just go on and on. And this one, I imagine, is any patient's worst nightmare, the idea that there will be an attempt to have a look at your private medical records.
Yeah, it doesn't matter who you are. We are all entitled to medical confidentiality, whether or not you're a member of the royal family or an ordinary person. And so this is a very, very serious allegation that has been made that a member of staff at the London Clinic tried to access the Princess of Wales's personal medical data. Now, we don't know whether they managed to, what they managed to see, but for anyone to do this, it's a criminal offence for any member of staff working in the NHS or a private medical facility to access patient data without permission. The Information Commissioner's Office has now launched an investigation. There is, as you set out, an investigation going on at the London Clinic as well. And the Health Minister, Maria Caulfield, today confirmed that the police have also been asked to investigate this. So it is being taken extremely seriously. And I think for the Princess of Wales, this just compounds the trauma of the last few months.
I mean, I'm going to talk to Dr. Philippa about the medical side of things in just one moment, but let's talk to you about the media and press side of things. Let's imagine there's an entirely unscrupulous person, either who works at the London Clinic or who knows somebody who works at the London Clinic and thinks, I know what we can do here. I can persuade this person, or I myself will be the person who accesses these completely confidential medical records. And then obviously, because the information is so desirable to so many people who've been so desperate to know the intimate details of what's wrong with the Princess of Wales, I will be able to sell this information to the highest bidder and really make an absolute fortune, maybe many millions of pounds selling this information. Are they right to think they could? Or are they wrong? Are the media constrained by the law and by what seems appropriate and wouldn't be allowed to publish anyway?
There's no way that in this country you would ever have a newspaper or a news organisation publishing private medical information of the Princess of Wales. And we don't know the circumstances around this at this stage. We don't know whether it was one person, whether it was several individuals. We don't know the motivation for it, whether it was just sheer nosiness, as you say, everyone saying to them, well, what's going on? You work at the London Clinic, or whether it was for commercial gain to sell that information to the highest bidder. But, you know, with the speculation has reached fever pitch around the Princess of Wales. And I think this is just yet another turn, but one of the more distressing ones, actually, because we have to remember at the heart of this is a woman who has gone through a very, very serious medical procedure and is entitled, as all of us are, to that same degree of privacy and respect.
Absolutely. And we do remember, don't we, the occasion when pranksters on, was it an Australian radio show?
It was, yes, 2012. The then Duchess of Cambridge, as she was known then, had been admitted to the King Edward VII Hospital, just a short distance from the London Clinic, with severe morning sickness during her first pregnancy with Prince George. And during that, two Australian DJs from a radio show phoned up the London Clinic with this prank call, posing as Prince Charles and the late Queen. And they were put through to Kate's nurse. And the most tragic consequences of what started out as a joke, that the nurse who initially took that call and transferred that call then went on to take her own life.
Very, very sad. And it just shows the kind of implications of what can happen when these very private, very personal medical details are tampered with or interfered with. Let's talk to Dr. Philippa Kaye about this. Dr. Philippa, obviously, as Sarah rightly says, we all, whether we're royal, whether we're very famous, whether we're not, have the right, don't we, to complete confidentiality.
Yes, and actually it's something that patients often worry about, but your doctors and your nurses are generally the best secret keepers you're ever going to meet. It is part of our medical duties. We are bound by the rules of medical confidentiality. Now, there are some situations where we might have to break that, and we would always tell you if that was going to happen. For example, if what was going on with you was putting somebody else or yourself at risk, so let's say that you had a condition which meant that you couldn't drive and you insisted on driving anyway, we would encourage you to contact the DVLA, but if you wouldn't, we would explain to you we were going to have to break it. But that is not what has happened here. What has happened here is that there has been an accusation that it hasn't been in the public interest, but that someone has gone for a look. And we have to remember that any patient in hospital is very vulnerable. And that the idea of having that information spread outside, whether or not you are a member of the royal family or Joe Blogs in the street, everybody is treated the same with regards to medical confidentiality.
And tell me about the level of detail in patients' very private medical notes, because, you know, people will wonder, what are the sorts of things that are there? Are there any things that are redacted? Are there some things you wouldn't put in because if they were to be found, they're so incredibly personal, incriminating, revealing about the person's life that you might not put them in the notes? Or is absolutely everything in the notes because it has to be trusted that no one who isn't supposed to see them will ever see them?
Writing medical notes is definitely a skill, and I think that it's probably something which has changed over the years, especially since patients now have access to their notes. They have the right to see their medical records, but it can be anything and everything from your blood test results to documentation about a conversation that you had. So, for example, if you told your doctor about an affair you had because you were either struggling mentally or that you needed sexual transmitted infection screening, that would all be in there. And doctors, GPs especially, are used to treating whole families, but that doesn't mean that you tell the whole family. Everybody is entitled to that confidentiality. But in the hospital notes, you would expect to have a history of what has happened, why, how have they got here, your first examination, set of investigations. After a surgery, you would have an operative note about exactly what happened during that surgery. And then afterwards, it will be anything and everything, including your blood pressure measurements to whether or not you've opened your bowels. And all of that is detailed along with the plan each day. So, for example, it might be take your catheter out or start physiotherapy, but everything would be documented in there.
And so therefore, people who are not in the royal family, but people who are famous and therefore their medical notes would be of interest to everybody and might even be considered to be in the public interest. You might even think of very senior politicians. You might think of, you know, just high-profile business people. How do they trust? How are they able to think, well, I have this condition, I don't want anyone to know about it, but I've got to have this procedure or this operation or this treatment, and I really don't want it to be public, but I can trust that either my NHS treatment or my private treatment will be entirely confidential because it's a crime. It's, as Sarah says, a criminal offence to leak this stuff, so nobody will. Or are they wrong to think that they can really trust the confidentiality?
They're absolutely right to think that they can. And actually, a concern about this story is that people might worry that they wouldn't have their notes kept confidentiality. It is in the GMC guidance, it is for doctors, it will be in the General Nurses Council for nurses, all the equivalent councils and regulatory bodies, the Information Commissioner's Office, the law. It is absolutely everywhere. Because it is vital, because if you can't tell me something and I don't know it, I can't help you fully without being fully informed. So as I said, there are some situations where we might have to break it, but we would always tell you. Now, when it comes to things like hospital notes, and I haven't worked at the London Clinic to know whether or not they're electronic or written, but if they're electronic, you have to have a login, and those logins will be auditable, which means that you can check who went in and what they looked at. So, for example, if in my GP surgery I needed to put something in somebody's notes who perhaps had passed away, who were deceased, it would say, why are you accessing that? What is the reason? And I would have to put in, because the coroner has asked for X, Y, or Z. Because it is auditable, there is a trail. So if these notes were electronic, it should be possible during the course of this investigation to find out who and potentially what was seen.
I need to ask you something else medical, and this is the question. We know that Kate has had serious abdominal surgery because she was in hospital for 2 weeks after the operation. We know that the royal family have said she needs this long period of convalescence. And what I'd like to know is all of the interest, the trolling, the malice, the speculation, the pressure, the releasing of the picture, the having to say, oh, I'm so sorry, I edited it a bit, I'm a bit of an amateur editor, I'm terribly sorry about that, I didn't mean to deceive anybody. All of that, you know, even the being filmed as you went to the local farm shop with your husband. Would that, do you think, or could that impede the tranquility, the serenity of most people's convalescent period? Is it really necessary to have calm and quiet and just get on with the business of recovering? And could all this speculation and feverish, you know, pontificating and you know, positing of completely ridiculous conspiracy theories, could that set back the recovery?
Stress comes in all forms. There are physical stresses, everything from, you know, a late night to a huge surgery, to mental stresses. And the impact of stress on the body is significant. And the impact on stress on things like sleep and appetite, which then impact the rest of the body, are significant. If you have had such a major surgery, there is a long period of recovery. So you might look okay, you might be walking around, your stitches might be out and your scars might be healing. But actually, the internal recovery process takes many months. And anything that has an impact on your stress levels, which then impact your hormone levels, things like cortisol, might impact your sleep, might impact your appetite, might impact all kinds of things, can absolutely have an impact on your recovery. And there's been an awful lot of frenzied hotbed of speculation in the past few months, but they were very clear in January that she wasn't going to be seen for this period of time because she needs to recover. And I think that, and I get the irony whilst I'm talking about it now, but the idea of accessing somebody's notes to potentially share that to other people is about as serious a misstep that can happen when it comes to medicine.
All right, and final question for you, Dr. Philippa. If you had a patient, which would be unlikely, in Kate's position, I don't mean royal, but I mean somebody who is the subject of speculation, who's been through all of this, you know, this rigmarole and this palaver that's kind of enfolded her ever since the operation pretty much, what would your advice be to them, your medical advice? What would you say they should do or not do for the final, let's say, 5 weeks of their recuperation?
I think that after you've had such a big physical trauma, that it can take a little bit of time for your head to catch up. That when your body is so busy doing the healing, when there's no energy because your body is taking all that energy up, that actually it takes a little bit of time after that for your head to catch up and for the healing that you need to do mentally to catch up after that. And I would say that as a society, a 24/7 turned on social media led society, we are not good at convalescence. But you have to do it properly in order that you will recover in the time frame that you want to. So I would say turn in, focus on what you need to do, move your body, eat well, try and sleep well, so that when you do come back into public life, you're able to handle it to the best of your ability.
Dr. Philippa, thank you very much indeed. I'll give the last word to you, Sarah. Is there any more news on the royal family in general, where we're going to see them when they're out and about, that kind of a thing?